Welcome to the Pre-Kidney Transplant Education Session. This education session has been designed as a self-guided PowerPoint presentation that you can view at a time that best fits your schedule. Completing this session during the assessment phase of your pre-transplant workup is essential, as it provides valuable information about the entire kidney transplant process. It also includes helpful resources and recipient testimonials to support you as you prepare for your kidney transplant. We encourage you to take notes and write down any questions you may have as you go through the presentation. You are welcome to watch the session more than once, since there is a lot of information to absorb. If possible, we recommend viewing the presentation with your support person. It is important for them to receive this information as well, since they will be accompanying you to appointments and assisting with your care at home after surgery. After reviewing the presentation, you will be required to submit an electronic form confirming completion. On this form, you can indicate if you have additional questions or would like a follow-up phone call from a pre-transplant nurse to address any concerns. Today, we'll be reviewing who your transplant team members are. We will explain the benefits and risks of a kidney transplant. We will discuss how eligibility is determined and the evaluation process, discuss living versus deceased donor transplants, learn how the transplant waiting list works, what is involved in the transplant procedure, what post-transplant care involves, what resources and supports are available to you, view recipient testimonials that share their kidney transplant journey and tips for going through the process, and finish with a review of frequently asked questions. Let's meet your recipient transplant team. First, our pre-transplant clerk that will contact you to schedule appointments and send you your welcome package. Your file will be assigned to one of our 2 pre-transplant registered nurses, who will support and guide you throughout the assessment and evaluation process. As part of the evaluation, you will meet with our program social worker to discuss any social and/or financial barriers you may face in receiving a transplant. At the Ottawa Hospital, there are 3 skilled kidney transplant surgeons, called urologists, who perform the transplant surgery. Finally, after completing the evaluation phase, you will have an appointment with one of our nephrologists to discuss your candidacy for the transplant and next steps. There are 2 different healthcare teams that take care of the recipient and the donor. As the transplant recipient, your care will be provided by the recipient team throughout the evaluation process. This team is separate from the donor team. For confidentiality reasons, the donor team cannot share any information about the donor's workup with the recipient team, as this is their private medical information. We fully recognize that in many cases, recipients and living donors have some form of a relationship, and you may share information with each other directly as you wish. It is your donor's decision what information they would like to share with you regarding how their workup for donation is progressing. What are the benefits? Kidney transplantation offers many benefits. A successful transplant generally provides a better quality of life. Transplant recipients report feeling stronger, more energetic, and less fatigued. Many people find that their thinking becomes clearer, and it's easier to focus and remember things after successful kidney transplant. Receiving a transplant also means fewer dietary restrictions and a return to normal fluid intake. The biggest benefit people report is more free time with family and friends to do the things they enjoy. Patients who receive a kidney transplant tend to live longer on average compared to those who remain on long-term dialysis. There are also fewer complications related to kidney failure, such as heart disease, bone disease, anemia, and nerve damage. Risks of a kidney transplant. While kidney transplantation offers many benefits, it's important to be aware of the potential risks. These include surgical risks such as infection, bleeding, blood clots, and death. It is also important to understand that kidney rejection and transplant failure are always a possibility. The transplanted kidney may not start working right away and require temporary dialysis. Anti-rejection medications, which are essential for preventing rejection, may increase your risk of infections and certain types of cancers. For instance, the risk of developing skin cancer or lymphoma is 2 to 3 times greater because of the immunosuppressant medications than in the general population. We will discuss how the transplant team effectively manages these risks throughout the presentation. The first step in the transplant process is determining if you are eligible to receive a kidney transplant. This is a conversation you should have with your multi-care kidney clinic team or dialysis unit. You can ask your team for more information if you are unsure of what is the right treatment option for you. A kidney transplant is not a cure, but it offers improved quality of life and freedom from dialysis. If you are considered a suitable candidate for a kidney transplant workup, a referral will be made to the transplant team. Your multi-care kidney clinic team or dialysis unit will then explain what tests are required to complete your transplant package. You will receive a welcome package from the Pre-Kidney Transplant team, which includes a transplant evaluation checklist and passport, which will be especially helpful in keeping track of what tests you need to complete. A letter which explains the workup process, a letter from your primary care provider, this is for your family doctor or nurse practitioner, outlining the cancer screening and other testing we require. A letter for your dental provider explaining that you are a potential transplant candidate and need any dental issues to be resolved prior to transplant. The welcome package also includes helpful information pamphlets such as finding a living kidney donor. Your transplant workup begins with the assessment phase. Your referral team will order the following tests: blood work and urine test to make sure the results are within acceptable ranges for transplant, a chest x-ray to check for lung conditions and assess heart health, an electrocardiogram, also called an ECG. This test shows how your heart is functioning by measuring the electrical activity of the heart, a Doppler, ultrasound of your lower extremities, your legs. This test looks for any narrowed or blocked vessels in your legs, a CT of your abdomen and pelvis. This scan provides detailed pictures of your bones, blood vessels, and soft tissues, an ultrasound of your abdomen. This test looks at the organs in your abdomen. A nuclear stress test, also called a stress test. This test checks the blood flow to the heart muscle at rest and under stress. And an echocardiogram. This is like an ultrasound of your heart. It looks at how your heart is working. The nephrologist may also order additional tests if required. During the assessment phase, you will also have a blood test to check your PRA, which stands for Panel Reactive Antibody. This test helps doctors understand how likely your body is to reject a transplanted kidney. It measures the level of antibodies in your blood that could react against a donor kidney. The lab will report a number between 0 to 100%. The higher your PRA, the more difficult it is to find you a compatible match. For example, if your PRA is 75%, then 75% of potential donors will not be a match for you, but 25% will be. If your PRA is 25%, then 25% of potential donors will not be a match for you, but 75% will be. You might be wondering what factors can increase your PRA. Your body develops antibodies when it is exposed to foreign tissue. This might happen if you had a previous transplant, a kidney transplant, a skin graft, bone graft, or heart valve replacement can cause antibodies to develop. Receiving blood transfusions can expose the immune system to foreign antigens. Women who have been pregnant may develop antibodies against paternal antigens from the fetus. Infections, some viral or bacterial infections, can trigger the immune system to foreign antigens. Vaccinations also work by triggering the immune system to recognize foreign antigens. After you have completed the PRA blood test, ask your nurse or care team what your PRA result is and what this means for you. Your assessment also includes cancer screening, which will be completed with help from your primary care provider. This is your family doctor's office or nurse practitioner's office. Colon cancer screening involves a FIT, which is a fecal immunochemical test for everyone between the ages of 50 to 74 years old, or a colonoscopy based on family history. Breast cancer screening involves a mammogram and is based on age and family history. Cervical cancer screening involves a Pap smear or HPV test to check for abnormal cells and the presence of high-risk human papillomavirus strains that can cause cervical cancer. Lung cancer screening involves a CT of the chest and is needed if you are a smoker between the ages of 55 to 74 years old or you have smoked for 20 years or more. Tuberculosis screening is required for everyone. We also encourage you to see a dentist to assess your oral hygiene, especially if you have not gone in the past 2 years. A dental assessment helps ensure there are no untreated infections or oral health issues that could lead to complications post-transplant. The evaluation phase begins once your testing has been completed. The transplant package will be sent to the transplant nurses for review. They will confirm that all the tests have been completed and that the results are within acceptable limits. Any additional testing that is required will be communicated to you. This will be followed by an in-person consultation with a transplant surgeon. The surgeon's role is to determine if a kidney can safely be inserted into your abdomen. The surgeon's assessment includes review of your health history, test results, and imaging studies to ensure there are no significant surgical risks. They will assess whether your blood vessels are suitable for connecting to the new kidney and if your overall health can withstand the surgical procedure. Your BMI, body mass index, and other medical conditions are important factors the surgeon will consider before surgery. In the evaluation phase, you will also have a telephone appointment with a social worker to assess your social and emotional readiness for transplant. They will evaluate your support network, including family or friends who can assist you during recovery. They will also ensure you have reliable transportation to appointments, discuss your financial preparedness for medication coverage, provide education and counseling to help you manage stress and anxiety related to the transplant process. The purpose of the appointment is to determine if you are prepared and supported for a successful transplant journey. The final step is to meet with the transplant nephrologist. This is an in-person consultation to discuss your candidacy with you. The nephrologist plays a key role in the final decision-making process, providing medical clearance and confirming that you are medically eligible to proceed with kidney transplant. Kidneys for transplant come from two main sources: living donors and deceased donors. A living donor donates one of their kidneys to someone in need. The living donor can be a family member, friend, or an unrelated person that chooses to donate. Kidneys from deceased donors come from individuals who have died from brain or cardiac causes and previously expressed their wish to be an organ donor. The family must also provide consent for the donation. This chart outlines the difference between living versus deceased donors. Kidneys from living donors last 15 to 20 years on average. Kidneys from deceased donors last 10 to 15 years on average. Donation from living donors can be preemptive, meaning before needing dialysis. Preemptive kidney transplants have the best overall health outcomes as you avoid the risk of dialysis-related complications. The average wait time for a deceased donor ranges from 3 to 5 years, depending on blood type. A kidney from a living donor typically starts working immediately after transplant, as there is less time between removing the kidney from the donor and implanting it into the recipient. A kidney from a deceased donor may take days or weeks to start functioning fully, as there was likely more time between removal and implantation. Living kidney donation can be planned based on the donor's and recipient's health and schedules. A kidney from a deceased donor can't be planned and is difficult to predict when a compatible kidney will become available. With living donors, there is a higher chance of finding a perfect match with a biological relative as you share the same genetics. A living donor can also be unrelated to you and still be a compatible match to you. With a deceased donor, you may wait longer to find a compatible match. There is a lower risk of rejection with living donors' kidneys compared to deceased donor kidneys. This figure and table from the Canadian Institute for Health Information shows the survival rates of transplanted kidneys from living donors at 3 months, 1, 3, 5, and 10 years by age at transplant. This data is from 2012 to 2023. For kidney recipients aged 18 to 44 at time of transplant, 82% of them still have a functioning kidney 10 years later. For those aged 45 to 54 at time of transplant, 78.5% of them still have a functioning kidney transplant 10 years later. For those aged 55 to 64 at time of transplant, 69.1% still have a functioning kidney transplant 10 years later. For those aged 65 and older at time of transplant, 52.5% still have a functioning kidney transplant 10 years later. This figure and table from the Canadian Institute for Health Information shows the survival rates of the transplanted kidney from deceased donors at 3 months, 1, 3, 5, and 10 years by age at transplant. This data covers the period of 2012 to 2023. For kidney recipients aged 18 to 45 at time of transplant, 72.4% of them still have a functioning kidney transplant 10 years later. For those aged 45 to 54 at time of transplant, 66.8% of them still have a functioning kidney transplant 10 years later. For those aged 55 to 64 at time of transplant, 53.1% of them still have a functioning kidney transplant 10 years later. For those aged 65 and older at time of transplant, 33.3% still have a functioning kidney transplant 10 years later. Living kidney donors must complete extensive testing before they are deemed eligible to donate. Their assessments and evaluations are completed by the living kidney donor transplant team. Potential living kidney donors can start the workup process as soon as you are referred for transplant. The goal is to avoid dialysis and to have donation occur before your kidney function or symptoms require it. This is called a preemptive kidney transplant. Preemptive kidney transplants have the best overall health outcomes. If you are already on dialysis, receiving a kidney from a living donor can greatly improve your health outcome as well. It eliminates the need to wait on the deceased donor list, which can be long and unpredictable. Additionally, the sooner you receive a transplant, the lower the risk of complications associated with long-term dialysis, and the better your overall recovery and quality of life. To determine if a living donor is a match for a recipient, 3 main tests are performed to evaluate compatibility. First is blood type. The donor's blood type must be compatible with yours for them to donate directly to you. On the next slide, we will go into more detail on compatible blood groups. Second is tissue typing, also called HLA testing. This is done to assess how closely the donor's tissues match with the recipient's tissues. The more HLA matches, the better the chance of a long-term success for the transplant. Third is the cross-match. A blood sample from the recipient is mixed with a blood sample from the donor to see if the recipient's immune system reacts to the donor's cells. A negative cross-match means there was no reaction, indicating compatibility. A positive cross-match means there was a reaction and the recipient's immune system is likely to attack the donor's kidney, indicating incompatibility. Compatible blood groups for living donors. There are 4 main blood types, A, B, AB, and O. Type O, which makes up approximately 47% of donors, can donate to all blood types. That is why it is called the universal donor. Type A, which makes up 40% of all donors, can donate to A and AB. Type B, which makes up 9% of all donors, can donate to B and AB. Type AB, which makes up 4% of all donors, can only donate to AB. Type AB recipients can, however, receive from all types of donors. That is why they are called the universal recipient. It is also important to note that blood group B and blood group O recipients may also be eligible for an A2 kidney donor. This means that someone with blood type B or O may be eligible to receive a kidney from someone with blood type A. A special blood test is done to check if your body would be okay with receiving it or not. This will be discussed further with you if this applies to you and your potential donor. If you have a potential living kidney donor who is interested in donating to you, we recommend that they visit the Ottawa Hospital's Living Kidney Donation website to learn more about the process. The website provides comprehensive information on eligibility criteria for potential donors, the evaluation process and required medical testing, resources and support services available for donors throughout their journey. The Living Kidney Donor team is also available to answer any questions and provide support at every step of the way. It is important to note that donor evaluations are confidential and conducted separately from the recipient's transplant team. Donors can choose what information they wish to share with their intended recipient. Additionally, donation must be voluntary, and donors have the right to withdraw from the process at any time without providing a reason. Finding a living kidney donor can be life-changing, but it's not always easy to ask someone to consider donation. Many people are willing to help but may not know how to start the process. Here are some tips for finding a potential living kidney donor. First, start by sharing your story. Let family, friends, coworkers, and your community know that you are in need of a kidney transplant. Many successful living kidney donor transplants happen because someone learns about a recipient's need and steps forward to help. You can ask people you know to get the word out for you, and share your story with people they know to reach a greater number of people. You can also connect with resources like the Transplant Ambassador Program to connect with others that have gone through the process and can provide guidance. Direct anyone interested in donating to the TOH Living Kidney Donation website so they can learn more about the process and receive answers to any questions or concerns they may have. Sharing your story through media outlets and social media can be a powerful way to connect with potential living kidney donors and raise awareness about kidney transplantation. Many individuals have successfully found donors by sharing their journey online or through news outlets. However, it's important to consider both the benefits and potential challenges of using these platforms. Things to consider before sharing include privacy and boundaries. Sharing your personal health journey is a big decision. Consider what details you are comfortable with making public. Accurate information. Ensure the information you share about kidney donation and transplantation are accurate. Misinformation can cause more trouble than help. Direct potential living kidney donors to the TOH Living Kidney Donation website for credible resources. Be prepared for both positive and negative feedback. Not everyone will understand the transplant process, and responses may vary. Finally, think before you post. Will this interfere with my care or the care of others? If the answer is yes, don't share. The Transplant Ambassador Program, also called TAP, is a patient-led and designed initiative to support individuals considering kidney transplantation, whether as recipients or donors. This program connects patients with transplant ambassadors, who are individuals who have first-hand experience with kidney transplantation or donation. TAP ambassadors welcome the opportunity to share their personal experiences with you, to help guide you through the kidney journey. They also offer personalized guidance as they have an ambassador directory, so you can find someone to speak to who has had a similar kidney experience. For instance, you may have diabetes and want to speak with a kidney recipient who also has diabetes to better understand how they manage their diabetic medications and transplant medications. Or you may be a donor being worked up to donate to your wife, and you may want to talk to a donor that donated to their spouse to understand how they manage recovery at home afterward. TAP can also help to bring awareness to your need for a kidney transplant by helping you to create a profile on their website to get your story heard. They can also help provide tips on how to have conversations with others surrounding your need for a kidney donor. We encourage you to remember to tap into the TAP resources on their website. You can request to speak with a transplant ambassador through your transplant team or by visiting the TAP website. They are available to provide support in person, through Zoom, phone, or email. They also have a presence on all major social media sites listed on this slide. Please take a moment to watch this excellent video from TAP ambassadors Mike and Paula. This video highlights the amazing resources and peer support available through the Transplant Ambassador Program. The Kidney Paired Donation Program, also called KPD, is a way to help more people receive a kidney transplant. If your living kidney donor is not a compatible match to you, then you have the option of entering this Canada-wide program as an incompatible pair. The program includes all Canadian provinces and territories and is operated by the Canadian Blood Services in collaboration with kidney transplant programs. It works by swapping kidneys between pairs of donors and recipients so that everyone gets a compatible kidney. For instance, if you have a donor that wants to donate but their kidney is not a good match for you because of their blood type or cross-match incompatibility, you will be offered the option of entering KPD as an incompatible pair. Both you and your donor must be okay with this. If so, your information is put into a national database that looks for pairs in the same situation. Match cycles are run 3 times per year, in February, June, and October of each year. You will be notified if you and your donor have been matched in a paired exchange or change. If you accept the offer, your donor will be scheduled to donate their kidney in Ottawa, and it will be shipped to the receiving program, which could be anywhere in Canada. You will be scheduled for transplant surgery in Ottawa and will receive a kidney being shipped in from another transplant program in Canada. The surgery dates will be coordinated with the other programs and will be booked based on operating room availability. This slide explains the types of matches that can happen with KPD. The first is a paired exchange, a donor exchange involving two pairs. The donor from pair A is compatible with the transplant candidate of pair B, and the donor from pair B is compatible with the transplant candidate from pair A. The pair exchanges donors and both candidates receive a kidney transplant. The second is a closed chain. Donors are exchanged in a chain of 3 or more pairs. The donor of the last pair donates the transplant candidate from the first pair. 40% of KPD chains are closed chains. The third is a domino chain. A non-directed anonymous donor is someone who wants to donate a kidney anonymously to anyone who needs one. NDADs is what they are called for short, and they could start a chain involving multiple pairs. This amazing act of kindness results in many kidney transplants and a kidney transplant for someone waiting on the deceased donor list at the end of the chain. This slide shows the kidney transplant programs across Canada. There are 6 adult kidney transplant programs in Ontario, 1 in London, Hamilton, 2 in Toronto, Kingston, and Ottawa. To learn more about the numbers of transplants happening across Canada, you can visit the website on this slide, which will take you to the Canadian Institute for Health Information. The KPD program started in 2009 and has found matches for many donors and recipients. The program celebrated its 1,000th transplant in 2024. KPD expands the search to a national network of donor-recipient pairs. This greatly improves the chances of finding a match, especially helpful in finding a match if you have a higher PRA percentage. If you or your donor would like to learn more about the KPD program and how it works, you can find additional information on these website links on this slide. My Pair Donation Coach on the Canadian Blood Services website can help explain the process in more detail. If you do not have a living kidney donor, you will be placed on the deceased donor waiting list once you have completed your evaluation and received medical clearance from the nephrologist and transplant team. Trillium Gift of Life Network, also called TGLN, is the organization responsible for allocating deceased donor kidneys across Ontario. There are 6 transplant hospitals in Ontario, which TGLN sends deceased donor kidneys to: Ottawa, Kingston, Toronto, London, and Hamilton. The kidney offer is based on blood type, cross-matching results, and position on the wait list. TGLN contacts the transplant center where the top-ranked recipient is listed. The transplant team then evaluates the offer, donor age, and cause of death, and decides based on the potential recipient's compatibility whether to accept or decline the offer. Once accepted, the kidney is transported to the transplant hospital for surgery. Your position on the waiting list depends on 2 main factors. First is your dialysis time. Each 30 days on dialysis gives you 0.1% of a point. Once you have been on dialysis for 10 months, you will have 1 point. The longer you have been on dialysis, the greater number of points you will have. The second is your antibodies. The higher your PRA, the greater number of points you will have. The formula we use to calculate this involves multiplying your PRA percentage by 4 and dividing this result by 100. For example, if your PRA is 100%, you will have 4 points. This is the maximum. If you have a PRA of 95% or more, you will be placed on the national waiting list for a greater chance of finding a match. In Ontario, there is an average of 1,000 patients waiting on the deceased donor waiting list. The average number of patients who receive a kidney transplant each year is 500. This is also the average number of new patients that are added to the list each year. 7 out of 10 transplant recipients are from a deceased donor. There are 2 main types of deceased donors. NDD donor means neurological determination of death. The brain has permanently lost all function, and a diagnosis of death using neurological criteria has been determined. DCD donor means donation after circulatory death. This is when a person's heart has permanently stopped beating. Kidney donors are also categorized into 3 different types. A standard criteria donor is less than 59 years old. An extended criteria donor is over the age of 60. Extended criteria donor kidneys are offered to recipients who are over 60 years old or to recipients who are diabetic and over the age of 50 years old. Exceptional distribution donor kidney is suitable for transplantation but may carry increased risk of certain infections or cancer compared to a typical donor. This will be discussed with you when the offer is made. It is your choice whether to accept or not. When receiving a kidney from a deceased donor, the organ is matched to a recipient with the same blood type. Blood type A has the shortest estimated wait list of 2 to 4.5 years. Blood type B estimated wait time is 2.5 to 5.5 years, shorter if able to receive an A2 to B kidney transplant. Blood type AB is hard to predict as it is a rare blood group, only 3% of the population, approximately 3 years. Blood type O has the longest wait time of 3.5 to 6 years. The table shows the number of kidney transplants done at the Ottawa Hospital over the past 5 years and breaks it down into the different categories. For instance, in 2024, there was 34 living kidney donor transplants completed at the Ottawa Hospital. There was 50 deceased donor transplants completed for those waiting on the deceased donor waiting list. There was also 4 from anonymous donors that donated to the waiting list and 1 that was possible because of the National Kidney Paired Exchange Program. This means that a total of 89 kidney transplants were completed at TOH in 2024, and many lives improved for the better. While waiting for a transplant, taking care of your health is essential. Eating well and maintaining a healthy body weight will help keep your energy levels up and prepare your body for surgery. Your dietitian is a great resource to help you plan balanced meals and make food choices that support your overall health. Staying physically active as much as you are able can also support a smoother recovery after surgery. In addition to caring for your physical health, it's important to look after your emotional well-being. Reach out to family, friends, peer support groups, and your social worker. Staying connected can help you stay positive during the waiting period. Having a plan in place for when you're admitted to the hospital and preparing for your return home after discharge can ease some of the stress and uncertainty. Waiting can be one of the hardest parts, as wait times vary and each person's journey is different. Your transplant team will schedule reassessments as needed to make sure you remain in good health and ready for transplant when the time comes. Staying connected with your transplant team is an important part of your care while waiting for a kidney transplant. Attend all scheduled clinic visits. This shows your commitment to your health and helps the transplant team know that you're ready and engaged in your care. Complete routine blood work as directed. These results are essential for the transplant team to monitor your health and make decisions about your transplant candidacy. Keep your contact information up to date. Make sure your transplant coordinator always has your current phone number and address. It is very important to be able to reach you if a kidney becomes available. Notify your transplant coordinator about changes in your health. If a medical issue arises, you may be placed on hold temporarily, but you do not lose your place on the wait list. You will continue to accumulate points based on your dialysis start date. Receiving the call for a transplant is very exciting, but it is important to remain calm. The pre-kidney transplant nurse will be giving you important information on where to go and when to arrive. Any specific instructions on whether you can eat or drink will be communicated with you. Make sure to bring everything you need to the hospital and notify your emergency contact. We also recommend having someone drive you to the hospital or to take a taxi. It is important to be aware that sometimes the transplant does not go ahead for a variety of reasons. For instance, it may be determined that the kidney is not suitable for you once it arrives to the transplant hospital. If this happens, stay positive. You will remain active on the list and you will be offered the next compatible kidney. The transplant procedure. If you are receiving a kidney from a living donor, you will be admitted to the hospital the day before surgery. If you do not already have a CVC, a central venous catheter, a PICC, peripherally inserted central catheter, will be inserted prior to surgery. The surgeries for both the donor and the recipient are carefully coordinated and will take place on the same day. This donor surgery typically begins in the morning, and once the kidney is removed and prepared, the recipient's surgery will follow. If you are receiving a kidney from a deceased donor, you will be instructed on when to arrive at the hospital, which could be within a few hours or even the following day after receiving the call for transplant. The donor kidney is carefully preserved and transported to the hospital for the transplant procedure. The less time between organ retrieval and transplant, the better the outcome for the new kidney. The recipient's surgery generally takes about 3 to 5 hours to complete. During the kidney transplant surgery, the surgeon makes an incision, a cut, in your abdomen, usually on the right or left side, as shown in the figure on this slide. The donor kidney is placed in the pelvic area. The blood vessels of the donor kidney are connected to your blood vessels, allowing it to start filtering blood. The ureter, which is the tube that carries urine from the kidney, is then attached to your bladder. A stent is also put in the ureter to help support the connection. One end of the stent curls into the bladder and the other end curls into the new kidney. The stent helps to keep the ureter open and allows urine to drain freely into the bladder from the kidney. It helps the surgical connection to heal properly and reduces the risk of urine leaks or blockages. The stent is removed 4 weeks after the transplant surgery by cystoscopy. A small camera is inserted into the bladder through the urethra and the stent is removed. Your original kidneys are usually left in place unless they are causing issues or pain, in which case the surgeon will discuss your options with you. Both your surgeon and nephrologist will provide guidance about the best approach for your specific situation prior to surgery. Please take a moment to view this short video explaining the kidney transplant surgery, including the placement of the stent. Once the surgery is completed, you will be transferred to the recovery area and monitored for approximately 12 hours. After this, you will then be transferred to the inpatient nephrology unit on the 7th floor of the TOH General Hospital. Pain management options will have been discussed with you prior to your surgery. This could include a pain pump whereby you push a button to deliver pain medication as needed, or taking pain medication by mouth. If you are experiencing symptoms such as nausea, bloating, or constipation, please ask your bedside nurse for medication that can help alleviate these symptoms. After your kidney transplant surgery, you will have a few medical devices to help with your recovery. One is a catheter. A tube will be placed in your bladder to help drain urine while your body adjusts. Another is a drain. You may have a drain to remove any blood or fluid from around the transplanted kidney to prevent buildup. A PICC line is there to deliver fluids and medications as needed. You will also be wearing compression stockings. These stockings will be placed on your legs to help improve blood circulation and prevent blood clots. You will also have a dressing, which is a bandage that will cover your incision site to help keep it clean and protected while it heals. After your kidney transplant surgery, several tests and checks will be done to ensure everything is going well. First is an ultrasound. An ultrasound of your new kidney will be done right after surgery to check its condition and confirm that it is receiving proper blood flow. This helps to detect potential complications such as blood clots or blockages. Second is a renal scan. The day after surgery, usually the next morning, you will have a renal scan to assess how well the new kidney is functioning. This test gives important information about the kidney's ability to filter waste and produce urine. Next is a blood test. Regular blood tests will be done to monitor how well your new kidney is functioning and to check for early signs of rejection or infection. Daily weigh-ins ensure that you are not retaining excess fluid. Monitoring fluid balance is important to avoid complications like swelling or high blood pressure. Vitals monitor for signs of infection, low or high blood pressure, and other complications. After your kidney transplant surgery, you can expect to stay in the hospital for approximately 5 days to 2 weeks, depending on how you are healing and any specific needs related to your care. You'll be encouraged to begin gentle movement, such as sitting up and even walking short distances, as early as the day after surgery. This helps prevent complications like blood clots and improves your overall recovery. Regular rest periods are also important to allow your body time to heal. Your catheter, which helps drain urine from your bladder, is usually removed within a few days, once you're able to go to the bathroom on your own. You will gradually transition from a liquid diet to solid foods as your appetite returns and your digestive system adjusts. Your transplant team, including doctors, nurses, pharmacists, and dietitians, will begin educating you about your new medications, signs of infection or rejection, and important lifestyle considerations after transplant. You'll have opportunities to ask questions and receive printed materials to support your learning. Family members or a designated support person are welcome to visit during your stay and can play an important role in your recovery and education. By the time you're ready for discharge, you'll have a plan in place for follow-up appointments, blood work, and ongoing support from the transplant team. Healing continues after you leave the hospital, and it's important to give your body the time it needs to fully recover. Be patient with yourself and allow time for rest and a gradual return to daily activities. Avoid lifting anything heavier than 10 pounds for the first 3 months after surgery to protect your incision and new kidney. Most people require 8 to 12 weeks off work, depending on the nature of their job and how they are feeling. Right after transplant, you will be started on high doses of anti-rejection medication to help prevent your body from attacking the new kidney. As a result, your risk of infections is highest during the first 6 months after transplant, while you are on higher doses of these medications and your body is still healing. During this time, take extra precautions to protect yourself from illnesses and avoid close contact with anyone who is sick. It's important to have a thermometer at home and check your temperature regularly, especially if you are feeling unwell. Monitor yourself closely for signs of infection, such as fever, chills, pain or burning with urination, redness, swelling, discharge from your surgical incision. You should also be familiar with signs of rejection, which may include fever, sudden weight gain, decreased urine output, flu-like symptoms, which are chills, fatigue, body aches, and pain or tenderness over the area of where your new kidney is located. If you experience any of these symptoms, contact your transplant team right away and go to the emergency department. Early detection and treatment are essential for protecting the function of your new kidney. After you are discharged from the hospital, your care continues through close monitoring at the post-transplant clinic located at the TUH Riverside campus. Your first appointment is typically scheduled for the day after you are discharged from the hospital. Before each clinic visit, you will need to complete blood work and provide a urine sample at the Riverside campus laboratory. These tests are essential for the transplant team to monitor your kidney function and watch for any early signs of complications. You will be seen 2 to 3 times per week in the early weeks after your transplant. As you recover and your new kidney continues to function well, the time between appointments will gradually increase. Eventually, if you remain stable, follow-up visits will be spaced out to once every 3 to 4 months. It's very important to bring all your medications in the original packaging to every appointment. This helps the team review your medications accurately, check for any issues, and ensure you are on the right doses. Your transplant team is here to support you through every step of the recovery, and these follow-ups are key to keeping your new kidney healthy.
This section will cover the medications post-transplant. After a transplantation, you will be prescribed medication called anti-rejection medications, or another name for it, immunosuppressant medications. These are used to prevent your body from rejecting the new kidney. They will need to be taken every day for the rest of your life or as long as you have the transplanted kidney. These medications can easily be integrated into your daily routine as they need to be taken once or twice a day. There are 3 classes of anti-rejection medications, and we combine one medication in each class to have the best effect in preventing rejection as each class works differently. The first class is the primary anti-rejection medication. They are named Advagraph, Prograph, Envarsus, and Neoral. The second class of anti-rejection medication is added to assist the primary anti-rejection one. This class includes Cellcept, Myfortic, Imuran, and Rapamune. And finally, the third class is a steroid type of medication such as prednisone, added to help the other 2 agents in preventing a rejection. You will also have to take medications to prevent some types of infections after your transplantation. This is because the anti-rejection medications suppress your immune system to prevent it from attacking your new kidney, which means it will make you more susceptible to infections. You will have to take an antibiotic for the rest of your life to prevent a type of pneumonia and an antiviral medication for a few months to prevent a type of viral infection. As with any medication, there are side effects associated with anti-rejection medications. The general side effects are mainly due to how these medications work. By suppressing your immune system, they increase the risk of infections and some type of cancers, such as skin cancer and lymphoma. Most of the side effects will be transient while your body is adapting to these new medications. They are usually worse at the beginning as the dose that we are using initially are higher, but they will decrease after a few months, which will help to improve the side effect. Our goal is to minimize or eliminate the side effect as much as possible. We might have to substitute some of your medications or add medications to help with the side effect for a short period of time. Sometimes it may take longer to find the best drug regimen for you, but it's important not to change anything on your own. It's also important to check with the transplant team before taking any new over-the-counter medication or herbal medicines to help controlling a side effect, as they may interact with your anti-rejection medications or damage the new kidney. This includes vaccines as well. This is a chart listing the main side effects of the medications used after transplant. Both cyclosporin and tacrolimus are in the same class of anti-rejection medications. They both can cause tremors, hypertension, increased potassium, and can be toxic to the kidneys at high doses. Cyclosporin is known to cause hair growth, whereas tacrolimus is more known to cause hair loss. Mycophenolate, the second class of anti-rejection medication, is known to cause mainly nausea, heartburns, diarrhea, and low white blood cell count. Prednisone, the third class of anti-rejection medication, has a fair number of side effects, which include nausea, heartburn, increased blood sugar, increased appetite, swelling, round face, mood and emotional changes, agitation, insomnia, and osteoporosis. The side effects of the medication to prevent infection are mild and mainly include nausea, vomiting, and diarrhea. More specific to the antibiotic, it will make your skin more sensitive to the sun, which will require sunscreen protection, and with the antiviral, it may decrease the white blood cell count. It is important to take your medications regularly after transplant. There are risks associated with not taking your medications. The first risk is to have a rejection of your kidney. There are two types of rejection. The first one is an immediate kidney rejection, which is when your immune system attacks the transplanted kidney acutely. The kidney function will drop and the creatinine will increase suddenly. The second one is a slow kidney rejection, which is a progressive, irreversible damage to the kidney. The kidney function will decline over time and eventually result in failure. The rejection can lead to transplant failure, which means you will be returning to dialysis treatment. Also, stopping your anti-rejection medication can cause the immune system to create antibodies against the donor kidney, making it harder to find another match and reducing the chance of another transplant in the future. When should you contact the transplant team? If you are unable to take your medications for more than 24 hours because of nausea or vomiting, we recommend that you contact the transplant team to get advice on what to do. You will be provided with a brief list of medications over the counter that are safe to take with your transplanted kidney, but you should contact the transplant team to confirm if it's safe to take any medications with or without prescription, herbal medicine, or vaccines that are not on that list. Lastly, if you developed a reaction or an unusual side effect to a medication, you should also contact the transplant team. It is important to have your drug coverage set up before transplant, as these medications are quite expensive. They may cost a few $1,000s per month. The transplant medications are usually covered by the public and most of the private drug plans, but they may not cover all the costs. Our social worker will ask you about your medication coverage during the transplant workup. These are the drug plans covering 100% of the transplant medications. We have the Ontario Drug Benefit for seniors over 65 years old, the Ontario Disability Support Program, the Ontario Works, the OHIP Plus for patients under 25 years old who don't have private insurance, the NIHB, which is the non-insured health benefit, private drug plans without deductible, co-payments, or maximums. Sometimes transplant medications are covered under a private plan, but they need a pre-authorization by the insurance company before. In that case, the transplant team will help you submit the extra paperwork, but it's important to provide these forms to the transplant team. These are drug plans covering portions of the transplant medications. The first one is the Trillium Drug Benefit Program, which will cover 100% of the medications once the deductible is reached. The other plans covering portions of the transplant medications are private plans who have co-payments, deductibles, or maximums to reach. If you are covered by a drug plan that covers only a portion of transplant medications, the transplant team can help you get financial assistance from a patient support program. If you don't have a drug coverage prior to your transplant, you will need to apply to the Trillium Drug Program. This is a program to help covering the high cost of medications after a transplant. You will have to pay a yearly deductible, which is about 4% of the yearly total household income. The deductible will be divided in trimesters. You should apply to the Trillium Drug Program while you are waiting for your transplant and keep it up to date. Attached is the link for the Trillium Drug Program.
After a kidney transplant, there are some important lifestyle changes to help support your recovery and protect your new kidney. Staying well hydrated, drinking plenty of fluid, about 2 to 3 liters of water per day, is essential. A well-hydrated kidney functions more effectively. If your kidney becomes dry, it must work harder to filter waste, which can lead to an increase in your creatinine level. Good nutrition plays a key role in healing and maintains your health post-transplant. Fortunately, your new diet will be much less restrictive than your dialysis diet. The transplant clinic dietitian will work with you to personalize your nutrition plan. Exercise and activity, while contact sports are not recommended, since the new kidney is placed in the lower abdomen and is more exposed to injury, non-contact physical activity is encouraged. Walking, swimming, yoga, and strength training, once cleared by your team, are all safe and beneficial. Sun protection. Due to transplant medications, your risk of developing skin cancer is higher. Protect your skin by wearing sunscreen, SPF 30 or higher, a wide-brimmed hat, and UV protection clothing whenever you are outdoors. Medications to avoid. You must avoid non-steroidal anti-inflammatory drugs, called NSAIDs. These include drugs such as Aleve, Celebrex, Arthrotec, Advil, Motrin, and ibuprofen, as these can harm your new kidney. You can take Tylenol if you have a headache, fever, or pain. A list of approved over-the-counter medications will be reviewed with you after your transplant. If you are unsure if a medication is safe to take, always check with your transplant team. To learn more about kidney transplants, we encourage you to visit the following websites provided on this slide. The following websites offer a helpful starting point for building a strong support system before and after transplant. We are excited to share heartfelt testimonials from kidney transplant recipients. Each of these kidney transplant recipients completed their evaluations and surgeries at the Ottawa Hospital and continue to receive care from our post-transplant clinic team. We are incredibly grateful that they have chosen to share their unique experiences and personal tips on navigating the transplant journey. Take a moment to listen, watch, and be inspired by their stories on this slide. The following 3 slides consist of frequently asked questions we have received from kidney transplant candidates. Please take the time to read through each slide as it may answer some questions you already have. We also encourage you to reach out to your pre-kidney transplant nurse if you have any additional questions throughout the assessment and evaluation process. We will be more than happy to answer your questions. There are several ways in which you can provide your feedback to the transplant program. You can contact your pre-kidney transplant nurse, speak to the transplant clinical care lead or transplant clinical manager at the numbers listed on this slide. Alternatively, you may contact the Ottawa Hospital Patient Relations Office at the number provided. A transplant doesn't just restore life, it restores dreams, possibilities, and hope. This is a quote from one of the TOH kidney recipients. This concludes the pre-kidney transplant education session. Please remember to complete the electronic forms questionnaire that was emailed to you with this PowerPoint presentation, and please indicate if you would like a follow-up call from one of the pre-transplant nurses. Receipt of the electronic form will confirm your participation in the education session. We hope you found it helpful. Thank you.